Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Leading NP expert Dr. Margaret Fitzgerald shares her knowledge and experience to help you dissect the anatomy of a test question, so you can better understand how to arrive at the correct test answer. So if you're ready, let's jump right in.
In which of the following situations is parental consent usually needed prior to treatment? A 16-year-old requesting information about contraception. B, a 17-year-old who wants help with smoking cessation. C, a 16-year-old requesting treatment for acne vulgaris. D, an 18-year-old who requests treatment for a sexually transmitted infection. Where do you start? First, let's determine what kind of question it is. Depending on how you look, this is either a professional issues or an assessment question. And to be honest, sometimes on boards it's a little hard to tell exactly what kind of a question it is. But the main objective of the question is to determine when an NP can offer the teen treatment without parental consent. All 50 states and the District of Columbia have legislation that protects adolescents to ensure confidentiality for treatment of select health issues. The purpose of this legislation is to enhance vital healthcare services to adolescents in areas where they might not feel safe or comfortable asking parents or guardians for input. This includes services related to contraception, substance use disorder, mental health services, and sexual health. The rationale here is that if the involvement of a parent or guardian is required, the teen might not seek these important services. And if you're thinking, well, of course the parents, the guardian should be involved, that would be ideal. But then when we look at the data, we'll see that upwards to half of teens say for the above-mentioned issues, if they had to get a parent or guardian involved, they would not seek care for these services. At the same time, whenever possible, parents and or guardians should be involved with as many areas of the teen's healthcare services as possible, and definitely parental and or guardian involvement is needed when the condition is viewed as being potentially life-threatening. Regardless of the condition, healthcare providers should be able to deliver confidential health services to consenting adolescents and young adults covered as dependents under the family's health insurance plan. In other words, being covered by your parents, your guardian's health insurance plan does not change the need for the healthcare provider to provide services in a confidential manner. Let's take a look at the options provided. A 16-year-old requesting information about contraception. Family planning is generally considered to be one of the diagnoses where the NP can assess and treat the teen and the absence of parental consent, regardless of the patient's gender identification or gender assignment. So that's not the correct answer. Option B, a 17-year-old who wants help with smoking cessation. Cigarette smoking is considered to be part of substance use disorder. Bearing in mind that many teens smoke without parental consent, smoking cessation services can be provided by the NP without parental consent. C, a 16-year-old requesting treatment for acne vulgaris. Acne, a condition that's noted in about 80% of all teens, but a far smaller percentage of teens actually asking for help with this, is not considered to be a condition where treatment is provided without parental consent or guardian involvement. This is our correct answer. Option D, an 18-year-old who requests treatment for sexually transmitted infection. Now, the key to looking at option D is this teen is now 18. 18 is considered to be the age of majority, where the teen now is able to self-advocate and is able to provide consent for health care. Being covered by parental health insurance does not alter the fact that this is now a young adult at the age of majority, and therefore all healthcare services can be provided without parental input, parental consent, or that of a guardian. Key takeaway: advocating for the teen patient is an important part of NP practice. Working with the teen to provide needed healthcare services in a confidential manner, if this is possible, helps the adolescent move forward in their self-advocacy.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.